I speak to patients that are just starting to understand their diagnosis and going through treatment almost every day. People find me and ask me questions and want to know, what helped me. And as much as I can, I try to help others. I really believe in paying it forward. And a couple of the tips that I share are these. One, the power of connection is invaluable because you only know what you have a chance to read and a chance to know through your physician team. But there's a lot else out there. And the more people that you connect, the more ideas you'll get, the more questions you'll have to ask. When you ask questions, that helps drive the dialogue and it helps drive your treatment and it might change your outcome. So I really encourage everybody to share their diagnosis. You never know who might know somebody else that had a successful treatment somewhere, and that will give you, the opportunity to pursue a similar path. I also tell people to do as much as they can every day for themselves and their own health. Even when you're feeling the worst, get dressed. If you can, take a walk around the block or take a bike ride, do whatever your normal exercise routine was. And if you can't do that, go up and down the steps a little bit in your house, or just, fold the laundry or unload the dishwasher. Do any of those little things that help, you maintain muscle mass. And I really do believe that is additive and it contributes to, fewer side effects. You need to stay flexible, you need to stay hydrated and nourished, and you need that muscle mass. And I would also say try to, do things that will give you hope. Try to find sources that give you hope. And that might be research, it might be talking to friends, it might be going back to work. But the key to that is for every day you can make it to the next day, pretty soon you're going to add up a whole string of days that this awful disease really wanted to steal from you. And in my situation, I had added up enough days and received enough treatment that it allowed me to be alive for immunotherapy to become an option for me. And if I hadn't had all of those days of, just being able to make it to the next, I would have never made it to immunotherapy years later. So I know how hard it is, and I know how discouraging treatment can be. But I just would say, have hope and find a way to make it to the next day, because science is moving so fast and you never know what is around the corner to help you. So don't give up, just make it to the next day. And pretty soon there's going to be something that hopefully will help your situation. One of my biggest pieces of advice is to advocate for yourself. No one can possibly know exactly how you're feeling or what you want out of your treatment or out of life. So you need to tell them. They all want to do the best job they can, but they've only seen what they have seen. And if your case is different, it's really important that you do some of the research for yourself. You ask the hard questions, ask the uncomfortable questions. You have talks that nobody wants to have about really disgusting side effects and things like that. And it's important to be honest too. Make sure that you speak up for yourself and drive the conversation, at least be part of the conversation. I really found that is what got me to solution-based treatment. I would also suggest that people connect with advocacy organizations like the Esophageal Cancer Action Network and other patient groups. There are a lot of resources out there that you might not have come across yet. So for me, they were very helpful, and very grateful for all of the people that I've learned from.